Well, hi, it's Dr. Doug Fryday again here with another Inside Out Lifestyle podcast. And I'm pretty excited with the guest I have tonight. His name is Cody Collison. And Cody has a number of stores in the area that sell CBD products. So we're going to be talking about CBD. And I guess the first thing we should probably talk about is, what is CBD?
CBD is basically the non-psychoactive cannabinoid derived from cannabis or hemp plant. Unlike THC, it actually blocks the CB1 and CB2 receptors in the endocannabinoid system that produce the euphoria, and they'll activate other receptors. There's three main ones in the brain and body called vanilloid, adenosine, and serotonin. And once those are activated, those produce things like dopamine and glutamate.
Right. Happy hormones.
Exactly. And they mediate a lot of the things in the body that can be so synergistic to help with things like epilepsy, to Parkinsons, to general anxiety and stuff like that.
Right. So tell us about, how I know you have your own personal story. Tell us about that and how it sparked your interest in this, in CBD.
Yeah. It first kind of all started when I was 15. And then my dad was diagnosed with just a rare intestinal cancer. And he went through the whole chemotherapy and everything and couldn't eat or anything, and first used CBD, well actually cannabis, to eat. And then I kind of sparked my interest in that. And then a few years down the road, I turned, I think it was around 18 years old, I had my first grand mal seizure. And then only 6 to 8 months later, I had a second seizure. And that one was a grand mal and a complex at the same time. And then from there, after you have 2 seizures, you're diagnosed as epileptic, and then you go through the run-of-the-mill medication and stuff like that. So I was taking a medication called Divalproex. I was on 1,000 milligrams a day, so it was really, really, affecting me, I guess, my overall lifestyle and everything.
In what way was it affecting you?
I would get like cold shakes. I'd walk around like a zombie, basically. All my receptors were basically just being blocked, so I just had no emotions walking around. I wasn't having seizures, but there was no quality of life.
Exactly.
Yeah.
So side effects.
Yeah, they were rough. Yeah, exactly. And then going to the my family doctor and even the neurologist, asking them if there was another path that we could take or anything like that. And they were just, shaking their head like, no, this is all we know. The CBD is kind of unknown. It needs to be more research. And then from there, I did my own research and was like, okay, well, other people are having success with this. I should just try it, because quality of life right now isn't going to improve anyway. So I didn't really have anything to lose.
Absolutely.
So then I just did cold turkey and was in tears the first night with the success I had. I had a clear mind, seizure-free still, anxiety-free. I was able to think, have brain cognitive function, all of that stuff again. So it really changed my life the first day, and then I started taking it for 3 years straight, and I've been seizure-free for 3 years now.
Awesome. That's awesome. And I hear that, all the time, not only about seizures, but all kinds of other maladies. And what are some of the other things that it does help? One
of the really cool stories that we have is the Parkinsons one. So like someone comes in and like actually having a Parkinson's episode, and they take some CBD in store. You can actually watch them stop shaking. So it's very, very cool with the Parkinsons. Another one is anxiety. So just general anxiety from life. Taking the pharmaceuticals is a good short term, but not really good long term, where CBD is the long term way to do it, in my opinion. And then it also helps with, just chronic pain, stuff like that, inflammation around the body. And then the brain cognitive function is really, really helpful for. So Alzheimer's, epilepsy, things like that.
Yeah, that's pretty cool. And I mean, when you look at taking something for anything, in my opinion, you have to look at the, risk to benefit ratio. Right? What kind of side effects, what kind of risk are there, and what are the benefits? Most pharmaceuticals, the risk outweighs the benefit in reality, when you really look at it. A lot of people don't look at it that way, but they really should. When you look at CBD, the benefit way outweighs any risks. In fact, I don't know of any risks. Do you know of any risks of taking CBD?
Yeah, over the years I've been taking it, I've always been scouring the internet. I've actually asked my teachers, because I went to the KPU school in British Columbia, so he's pretty well surrounded by the industry, so he knows a lot as well. And I asked him, and the only thing that I can find is it's a water-using molecule, obviously, so you're going to get dehydrated if you don't keep up with water intake.
Right.
But other than that, there's this one where if you're taking CBD long-term and you're taking pharmaceuticals long-term with CBD, it's not a good idea, because CBD will inhibit the cytochrome P450 enzymes in the liver. But that's just a family of enzymes that helps break down human pharmaceuticals. And I tend to scare people when I say that, but it's actually kind of a benefit in the liver when you actually have it happen, but it can be scary when you have pharmaceuticals breaking down in that at the same time and stuff like that.
Right. So there really isn't that any side effects to taking it.
Absolutely not.
So let's get into, I know there's some trepidation or myths about CBD and THC. And I know, there's two different type of plants. The one containing CBD and THC, the other a hemp plant that, and you can correct me if I'm wrong, because you definitely are the expert on this.
Try my best, that's it.
You're well schooled and self-schooled, and then you went to that school as well.
Yeah,
huh?
yeah.
Cool. So let's talk about that, because I know as soon as you say CBD, people immediately think of marijuana and they think of THC, of getting high and that type of thing. So let's talk about that.
Yeah. So just an important thing from just like a Stop and Smell the Roses standpoint, all of our products are derived from industrial hemp. And like you said, the hemp plant, it does have a difference in cannabis. They're the same family, but the only difference is cannabis has an abundance of cannabinoids. So cannabinoids, hemp has lack of cannabinoids. So it just doesn't have the amount of THC to produce psychoactive highs. So that's why we're legally allowed to use the CBD from hemp, but not CBD from cannabis, because then we can get trace amounts of THC from the cannabis.
Right.
But yeah, there is a big stigma surrounding even the two cannabinoids now, and a lot of people go like, when I take CBD, am I going to get a body buzz? Am I going to get high and stuff like that? But it's actually going to block the CB1 and CB2 receptor. So that's what THC attaches to produce the euphoria, like I said earlier. So when you get those blocked, it actually inhibits the chance to get psychoactively affected.
Right.
So when you can actually take THC, and if you get uncomfortable, you can take CBD, and it'll counteract the effects.
Yeah. I didn't know that. That's good to know that.
But sorry to interrupt, but it's also important to note that THC and CBD work really, really well together. So CBD will decrease the psychoactive effects of THC, like I said, but THC will also increase the medical benefits of CBD. So those 1-to-1 ratio products out there by licensed producers like 7 Acres are really, really good as well.
Yeah, and I know they synergistically work well together.
Exactly, yeah.
And you can, I know you can get different percentages of CBD, THC, depending on the plant.
Yeah.
And I guess there is, depending on the different percentages, they treat different things.
Yeah, it's just different percentages are like a potency, I guess, for the product. And it just offers a cheaper product for someone that doesn't need the highest dose.
Right.
But generally speaking, you would want the highest dose to get the most benefits.
Right.
But yeah, it just offers a variety of products when they do that.
Yeah, and those which have the CBD THC combination, you can only get through right now through medical marijuana sites. Yeah,
they're called licensed producers, and there's. I could be wrong now. When I looked a few months ago, there was 23. There's always, there's over 2,000 applicants or something like that. So there's 23 running right now that you can get from, and only a few actually have their selling license. But if you get a referral to a doctor from them, you can order from the websites and stuff.
Right on. So getting away from that, when we're talking about CBD that somebody can come in and into Stop and Smell the Roses and buy, there is minimal, if not no, THC in that product. Is that correct?
Yeah. We actually do offer two kinds of CBD. So there's the full spectrum CBD that does offer the trace amounts of the other 100 cannabinoids. So not just THC, but there's CBN, CBG. I could go on the THCV.
Yeah.
There's so many of them that are beneficial. So when you have full spectrum CBD, it's actually a lot better than non-full spectrum CBD.
Right.
But we also offer the non-full spectrum CBD for people like Bruce Power workers, like I said earlier off air, the MMA fighter that we just had sponsor, he needs to pass the test, right? So
Right.
CBD actually does pass THC test if you are using non-full spectrum CBD. So if you're using full spectrum, you can actually fail a test.
Fail a drug test. So we're talking about drug work related
Exactly,
tests.
yeah.
So
So-
anybody at Bruce Power that needs to do drug testing,
Yeah.
they would only be able to have the CBD, not the full spectrum CBD.
Exactly. Yeah.
Okay.
Exactly.
Well, that is good information to know,
Mhm,
because
yeah.
I know I've had that conversation with before with people ask me, well, what's it going to do to a drug test at work?
Yeah, exactly. And that's really important. We don't want to inhibit any kind of workplace. And that's what's cool. They've actually allowed CBD to be in the workplace from industrial hemp. And you can even go all the way up to working on heavy machinery with CBD, as long as it's proved from industrial hemp and it's under the THC psychoactive amounts, so the 10 UG/G-THC.
Well, if I'm not mistaken, it does increase your focus, does it not, CBD?
Mm-hmm. Yeah.
So
Yeah, it's definitely not going to inhibit anybody's work unless they're on, I would say, like 1,500 milligrams. Then they're going to get a little tired,
yeah.
and that's a high dose.
Okay. The other thing I was going to say is, tell me about the endocannabinoid system that we all have within our bodies.
That's something that actually I'm really, really fascinated about, and I hope that our actual school systems start teaching it really soon, because it goes down from a seahorse. Every mammal has this down to a seahorse that has the endocannabinoid system that takes in cannabinoids and basically digests them properly like a digestive system, but it puts it and activates these receptors all throughout the brain and body, giving off all of these synergistic effects.
So we can get cannabinoids from other products as well.
We sure can, yeah. And right now it's basically just THC and CBD, just because growers have bred up those cannabinoids in the plant through natural selection in genes and stuff like that.
Right.
But soon you'll see that they'll grow up. The next one I hope to see is THCV, because it's a natural stunting hunger.
Okay.
And a lot of people want to do weight loss, but there's a lot of these nasty products out there where THCV can do it naturally. So
Yeah. Instead of suppressing your appetite and things like that.
Exactly,
Suppressants,
yeah.
which have, again, the risk-benefit ratio, lots of side effects.
Yeah, so I think that cannabis in the future is going to branch out to all of these cannabinoids, not just THC and CBD, because there's so many different ones that benefit different things, and we're just on the tip of the iceberg.
Yeah, it's
and then
just
we
starting.
talk about terpenes, which is the oils in cannabis that also affect the body differently through aromatherapy or actually ingesting as well.
Yeah, and is that where do you get terpenes in the full spectrum?
Yeah, exactly. We actually use hemp terpenes in all of our products, so you do get the hemp terpene effects, but not cannabis terpenes, not like pinene or limonene yet, but we hope to in the future once it's accessible.
Right on. And so what's the difference too? I know there's some confusion on hemp oil and CBD oil.
Yeah. Hemp oil is a really good product as well, but it has the balance of essential fatty acids and omega-3, like the omega-3 and stuff like that. There's no CBD in it whatsoever, because it's derived from the seed or stalk of the plant.
Okay.
It's really, really nutritional and good for the skin, so it actually won't clog the pores, and it gets in deep and moisturizes and stuff like that. But
Right.
not really medicinal you're not going to activate the endocannabinoid system with the hemp oil.
So it's nutritional, not therapeutic.
Exactly, yeah. And we do offer the hemp oil actually as well,
Right.
because the nutrition benefits, it's called a complete protein,
Right.
Meaning that it has all of the essential fatty acids that your body doesn't produce.
Cool. Now the endocannabinoid system, it fascinates me too. Now you said it's in all mammals, so that's obviously why you sell products with CBD for pets.
Yeah, exactly. Yeah, they're going to get the same benefits and same negative effects with THC, and we don't really know a dog's brain, so we're not going to give them THC and have that euphoria. But the CBD is really beneficial for things like thunderstorm anxiety, separation anxiety, hip dysplasia. With the breeding that we do now, the hip dysplasia is a large thing.
Yeah.
Mobility, even cataracts. Actually, we cleared up cataracts in a dog. So
Very cool.
Yeah, it's really, really helpful for them.
Nice. So tell me about, where did the name Stop and Smell the Roses come from?
It's not much of a story really, but I was in Toronto living in an apartment with my brother actually, and I was just off the phone with my mother, and I asked her how to start a business.
Right.
And she told me that I needed money, and I said, well, why don't I get a name first? And then she said, okay, well, what do you think of? And then I said, Stop and Smell the Roses, because I knew I wanted to have it related with cannabis, but I didn't want to, I wanted to kind of subtly say that we're about cannabis. So Stop and Smell the Roses just seemed perfect.
Right.
And we also wanted to change the stigma surrounding it. So
yeah, and that's the thing we've talked about tonight is this stigma, right?
Exactly.
As soon as you say CBD, and in fact, I've referred some patients out to you that have had many issues, but explaining it to them. The good thing of most people that come to a chiropractor are open-minded.
Yes,
right?
yes.
Even these older people, which is very cool. And when I suggested it to them, they were very cool. They didn't have a real problem with it.
Yeah, and that's a huge change because, even 5 years ago, 10 years ago, you brought it up, the reefer madness was still full in effect. So
yeah. It's pretty silly when you go back and look at all of that reefer madness stuff, the way hemp has been treated in North America. Yeah. What's it called? The letter of the Constitution and everything, and it was written on hemp paper.
Exactly. Yeah.
Right?
In America. Yeah. In the U.S. Yes.
And there's a whole story. There's a whole show on that as well. But anyway, what are some of the other, what are most people coming in and getting CBD for?
Right now, it's actually a lot of education, which is what we're happy to see. They're
coming in asking questions.
And it's usually for someone else because they're just not willing to come in yet.
Yeah.
So it's really cool. But the main things are chronic pain. A really tough one is fibromyalgia because they go through the run-of-the-mill things before they it's basically anything that goes through the run-of-the-mill medication. So we see a lot of different things through epilepsy. Parkinsons is another big one. We do have a few cancer patients.
Right.
We've actually had success with a cancer patient, just to end on a hopeful story. She was stage 3, and she gave me permission to tell this, by the way.
Awesome.
But she was stage 3, and now she went to stage 1 just using CBD, and now she's cancer free. And by the time they removed it, it was about this size. So it was really, really fascinating to see using zero chemotherapy.
Wow, that's a great story. What was the other thing I was going to say about CBD? I know, anxiety. I don't know about you, but I am seeing from kids, young kids to teenagers to young adults to, the whole gamut. Huge issues with anxiety these days. And my take on it is that we're living in a pressure cooker world, and we're so overstimulated that our nervous systems are just on edge. We're in fight or flight all the time. I call it pedal to the metal syndrome, right? So everybody's anxious. I know that CBD can really help with anxiety.
Yeah, especially with the adenosine receptors. That's the biggest play on anxiety. Is it'll regulate the hormones that cause the anxiety, and,
right.
And also I believe that anxiety stems from the terrible sleep cycles that everybody has.
Yes.
So, if we talk about REM sleep over deep sleep, so REM sleep being rapid eye movement when you're not healing or removing toxins or balancing hormones, and deep sleep is the opposite. So you're actually balancing hormones, using hormone secretion, you're removing toxins, you're healing, and that's the best medication is deep sleep. And when you take CBD, it doesn't make you drowsy, but it regulates your sleep pattern so that you're in more of a deep sleep than REM sleep. And you can actually wear a Fitbit and track the difference. And deep sleep is if you get bad sleep, you're going to start a bad snowball of anxiety, and then the next night the hormones just keep getting more and more imbalanced until you can't deal with it. Where deep sleep, if you start a good snowball of deep sleep, you're just going to get better at dealing with it with these pathways and the balancing of the hormones.
Yeah, sleep is hugely important. You're correct on that, because that is when your body repairs, rest and relaxation, and repairs itself, right?
Yeah.
And especially you got to get into deep REM sleep.
Yes.
One thing you know, when you are in deep sleep, you're dreaming.
Mm-hmm.
And when you dream, that's a good thing. You
Yeah.
know, you're in deep REM sleep,
Yeah.
and your body is repairing itself.
Mm-hmm. And there's no like medication that can match the medical benefits of a good deep sleep.
Absolutely, absolutely. And if you can, you know, put yourself into that with a natural product with CBD, it only makes sense, right? There's all kinds of other things you can do to help with sleep as well.
Absolutely.
And that's a good idea. We may have a whole podcast on that.
It's very important.
You know, meditation, deep breathing, those type of things. Anyway, I want to thank you for that information. Our community is going to be much more knowledgeable on CBD, and therefore that much more healthy.
Yes.
So you've got how many stores now? You started off in Port.
Yeah, we started in Port Elgin, and then we franchised to Hanover and Owen Sound, and now we're going to Orangeville.
Awesome. And after that, what are your plans and goals?
I actually started another company. It's just a side one for Colson Canadian Glass, and it's just a glass company that makes high-end Canadian glassware like wine glasses, and also it's a big market for the cannabis industry is glassware, so that's what we started, as well as we're going to British Columbia in 2 months, so we're going to start up Stop and Smell the Roses in British Columbia.
Awesome.
And then from there we're going to be cannabis retailers, because they're actually open to private retailers over there, where Ontario it'll be a little bit of a battle.
Right on. And speaking of that battle, what's going to happen with this law change coming up in July? Do you know anything on that?
Well, they're definitely, I believe that they're going to push it back for all kinds of reasons, mostly political, of the elections coming up soon. But they're going to push it back because there's just not enough time to get it all out there, especially with how much the provinces are left to do. And Ontario seems to be, conservative in their way of going about it. They want to be really safe, they're saying, but they're kind of monopolizing the whole distribution and retail of it. Right on. Where British Columbia is kind of letting it go, like the craft beer market over there, where they have small business. There's a lot of competition between pricing and quality over there. Yes. Where over here it's just LCBO and beer stores, right? And that's kind of the same thing that's happening with cannabis, but there's also a much larger battle happening with cannabis. There's more protests going on, so I don't think they're going to get away with it as well as they did with liquor. Right. But yeah, that's why we're starting with British Columbia, and then we'll just trickle down to the provinces.
Well, again, I want to thank you for coming in and doing the podcast, and our community is only that much stronger knowledge-wise and health-wise, and that's what this Inside Out Lifestyle podcast is all about, knowledge is power, and to make better choices for your healthcare.
Well,
so thanks again.
Thank you. It means a lot to be here.